Hello and welcome to Down the Scope. Today we're going to be looking at a full necropsy case and working out how this mass in the nasal cavity of a cat led to a brain infection. I'm a veterinary pathologist and part of my job is investigating the causes of death in animals. I have permission of the owners to use the photos and material collected during the necropsy. Unsurprising, because this was my family's cat, Florence. You might have seen her in some of my other videos on normal histology. This video is also a little tribute to our furry companion, who brought us so much joy, and my intention in collecting and presenting this material is so that we can all learn a little bit about the disease process which led to her death. Florence was an elderly, approximately 18-year-old cat who developed incoordination and inability to stand after a short period of illness with fever and inappetence. She had had previous periods of similar clinical signs where she developed a fever and stopped eating, but this generally resolved with antibiotics and anti-inflammatory treatments. We had adopted her 3 years previously after she was abandoned and recovered by a local animal charity. She had always been deaf. From the history, we can start to focus on certain organs that might be affected by the disease process. Coordination of movement is controlled by a part of the brain called the cerebellum, and conditions affecting this area can result in generalized incoordination. But I wouldn't rule out lesions in other parts of the brain, the spinal cord, or peripheral nerves that could result in incoordination. Another thing to consider is the type of process that might be affecting the cerebellum. For example, could it be a nutritional or infectious or neoplastic process? In an older animal, neoplasias or cancers become more common, so this would definitely be on the list. Primarily, I was thinking of a meningioma, which are common in older cats and can compress the brain. However, this would not necessarily cause a fever or more generalized illness, and would probably have resulted in more progressive and slowly developing symptoms. An infection would cause a fever and rapid development of symptoms, so this was also high up on my list. We went ahead with the post-mortem examination and removed all of Florence's organs to examine them carefully and look for any abnormalities. There were a few small abnormalities in the liver, but otherwise there was nothing remarkable in the abdomen or the chest. When we removed the top of the skull, there was a large amount of creamy, viscous material over the cerebellum. This is the typical appearance of what's known more commonly as pus, and represents an accumulation of acute inflammatory cells, such as you would get in an infectious, usually bacterial process. So that's it, right? We've found the cause of the clinical signs that the cat had, and we can wrap it up there and tell the owners that the cat had developed a brain infection. But that's an unsatisfying conclusion to a pathologist. This finding just brings up more questions. How did the bacteria get from the outside to the brain? Why did this particular cat develop a brain infection when there are thousands of other older cats that will never suffer from one? It was time to investigate further, so I opened up the skull a bit more to have a look at the middle and inner ear. The middle ear on both sides was filled with material, some of it like pus, but some of it was more granular and chalky. We took swabs from the middle ear and from the brain for bacterial culture, and then samples from each of the organs were preserved in formalin and processed for examination under the microscope, a process called histopathology. I preserved the entire head in formalin so I could go back and take sections through the ear canals and associated bony structures. In this image, you can see that the tissue has gone brown and grey from the action of the formalin. You can just about make out some of the structures. For example, here is the external ear canal with the eardrum and the middle ear. You can see that the middle ear is filled with material, but the external canal is clear and healthy. This tissue was placed in a little plastic cassette and processed using various chemicals. Then it was embedded in paraffin wax before 4 micrometer thick sections were taken, floated onto a glass slide and stained. While I was taking the sections from the ear, I noticed something in the cat's nasopharynx. Let me explain this picture to you. The head is upside down and we're looking from the back towards the nose. Here is the cranial cavity where the brain would be. Here's the skull, and these are the salivary glands. In the center, there should be a passage called the nasopharynx, which connects the nasal cavity to the back of the throat. This is what lets you breathe through your nose. Blocking the cavity, there is a mass of tissue. But what could it be? Well, there's only one way to find out. Look at the cells that are making up the tissue and characterize it based on their morphology. So, more histopathology. First of all, let's look at the ear. At the lowest magnification, you can see that this is a fair representation of the tissue we saw earlier. Here's the external ear canal, and you can see the middle ear as well. The middle ear is divided into two parts, the tympanic bulla, which is a large airspace at the base of the skull, and the tympanic cavity, which contains air and the tiny little bones that transmit vibrations from the eardrum to the inner ear. We can see the eardrum here as a thin sheet of connective tissue that separates the tympanic cavity from the external ear canal. There's even a little section of one of the middle ear bones and the muscles which control them. Both the tympanic cavity and the bulla should be filled with air, like the external ear canal. Instead, they're filled with material, so much so that the eardrum is bulging out towards the ear canal. We'll have to look at higher magnification to find out exactly what this material is. Most of it is a mass of inflammatory cells. These small ones are neutrophils, and the larger ones are macrophages. Both are part of the innate immune system and will phagocytose bacteria and other debris. We can even see some macrophages that have eaten the neutrophils. If we could see only these cells, it would mean that this was a fairly acute or sudden process. But there are other elements to the material. In between the inflammatory cells, there are large areas of fibrous tissue with blood vessels and huge numbers of lymphocytes. These are part of the adaptive immune system and are usually seen in more chronic inflammation. This means that while there is an acute component to the disease process, there have either been previous infections or some sort of proliferative process that has filled the ear canal with fibrous tissue. Within the fibrous tissue, there are some glands as well, which is an odd type of tissue to find in the middle ear. You'd usually see something like this in the nasopharynx. So we found some more clues to solving the case. There was a severe middle ear infection, an otitis media. This didn't come from the external ear canal. We can clearly see that the eardrum is intact. The middle ear is also filled with a mass of proliferative tissue with glands that are usually present in the nasopharynx. If you know your middle ear anatomy, you'll know that there is another opening to the outside world, the auditory tube that connects the middle ear to the nasopharynx. So the infection must have come from there. But why? I think it's time to look at the mass that we removed from the nasopharynx. It doesn't look very interesting under the microscope. There's a covering of epithelial cells over a mass of fibrous connective tissue, with occasional glands and little bits of inflammation. It looks very similar to the unexplained fibrous tissue that we found in the middle ear on the other slide. This is the typical appearance of a nasopharyngeal polyp, a common inflammatory mass in cats. They usually arise in the middle ear or auditory tube before growing into the pharynx, eventually blocking the flow of air from the nose to the larynx. The underlying cause is not known. The presence of this mass would have predisposed to ear infections and was severe enough to cause deafness, especially if there had been previous ear infections that cleared up but damaged the middle ear. The nasopharyngeal polyp explains a lot, but there is still one element to the case that we haven't solved: the loss of balance and infection in the brain. Here's a section of the brain, specifically the cerebellum, that we saw earlier grossly. Covering the surface in layers of connective tissue called the meninges, there are more of the acute inflammatory cells that we saw in the ear, lots and lots of neutrophils. If we look at the superficial brain tissue underneath, there are just a few neutrophils making their way into the tissue. This would be enough to disrupt the function of the neurons in the cerebellum and cause incoordination. This is what's called a meningoencephalitis, inflammation of the brain and meninges. This fits with a bacterial infection. Remember the swabs we took from the middle ear and the brain? Both of them grew a bacteria called Pseudomonas aeruginosa. This is a common commensal in the ear canal and nasopharynx of animals, but acts as an opportunistic pathogen, causing ear infections under the right conditions. The fact that we cultured the same bacteria from both the middle ear and the brain suggests that we can treat these lesions as the same process. The most likely scenario is that the bacteria spread from the middle ear to the brain. And how did the infection get from the ear to the brain? If we go back to our section of the ear, we can find the answer. In one corner of the slide, there's a large nerve. Both the facial nerve and the chorda tympani, a smaller nerve, pass close to or through the middle ear before connecting to the brain. Look around the nerve and you'll see more neutrophils. The most likely scenario is the infection has tracked from the middle ear along this nerve and arrived at the brain, causing the meningoencephalitis. Now, I really feel like we've explained everything, so let's summarize. Florence had an inflammatory mass which grew from her auditory tube into both the nasopharynx and the middle ear. This would have resulted in deafness, but also predisposed to infections. Pseudomonas aeruginosa, a common commensal bacteria of the nasopharynx and ear, took advantage of these conditions and established an infection, causing inflammation, fever, and inappetence. The infection spread from the middle ear to the brain along the chorda tympani nerve, resulting in meningoencephalitis and incoordination. And that's how the nasal mass led to a brain infection. Doing the necropsy was also useful for me personally. I found out why Florence had always been deaf. It made sense that she snored when she slept because her nasopharynx was blocked by the mass. It also helped me justify my decision for euthanasia when her symptoms became severe. The mass had probably been there since before we adopted her, and only a surgery called a tympanic osteotomy would have prevented the secondary infections she developed. I'm happy we could give her a loving, comfortable home to finish her days in. Thank you for watching to the end of the video, and thank you to Florence for being the best cat ever.